you look at the world a certain way. You look at the world through equations, and you understand relationships between signal-noise ratio, contrast ratio, all the things that I should know a little bit about, but I couldn't possibly explain that mathematical formula. On the other hand, if I were to show you that angiogram, you would not realize that it was a hepatic arteriogram in a liver transplant who had a bioloma drain in place and probably was sloughing his biliary tree as we speak because the arterial stenosis right there needed to be stented. And so I would stent it and not think about the equations. I might think a little bit about the dose now because after I met Bob Dixon, I started to learn all about physics, and I've met a handful of you guys and gals, and I've come to develop a little passion about teaching physics. Now I'm the program director, so I really care. So I'm going to keep it simple today. I just want to give you an appreciation of some of the clinical stuff that I come across and the way I think in interventional radiology. So in fact, all of these examples that I'm going to show you are cases from IR. They're not necessarily diagnostic radiology, but the other point I want to get across is there is a huge, gigantic need to educate the operators who do interventional radiology. And all of you know that that includes interventional radiologists and cardiologists, and then about a dozen other specialties, people who use fluoro for different injections, the GI folks who use it during their endoscopies. But I would like to petition all of you to remember to keep it simple for us. We're not that smart, but if you keep it simple, maybe we'll start doing this. And the trick is, I've learned over the years, is not to try to target the old guys and gals, but to target the young guys and gals, the residents and fellows, and you will start to see them adopt some behavior. And the question I always try to ask during a case is, do I really need that image quality to get the job done?